Hey guys, it's Dr. Ted Koontz. We're back on today's Daily Prime, and I just wanted to share kind of a topic and a story because I've been seeing this a lot lately. People coming in diagnosed with sciatica. They're feeling pain down the middle of their backside of their thigh, and it's worse when they're usually bending over, or first things in the morning. It's even changing the way they can get up out of a low seat or walk, and it's got them really concerned when they come in to see us. They, consulted with Dr. Google. They are asking all their friends and family members what's going on. They go to the doctor offers a corticosteroid, and it's got people panicking. So I wanted to share with you today one secret that I recently discovered when you've been diagnosed with sciatica. That is, most often, believe it or not, they're not truly sciatica-like diagnoses. What I'm actually finding out as of recently, the hamstring muscles myofascially can reproduce some really strong and significant pain along the backside. So what I would do is I would get you lying down on your stomach, and just by simply kind of palpating and feeling the muscle tissue. Muscles and nerves kind of work together or don't work together, if you know what I mean. The nerves can have a tough time piercing through. You can kind of think of it like that. The nerves piercing through the muscles. And sometimes, especially as we sit a lot, drive a lot, we're not maybe moving like we used to or stretching our hamstrings like we need to, everything gets really tight in there. So all of a sudden you have a nerve that's having kind of a hard time getting through, in this case, the hamstrings. And probably more correctly diagnosed as a different form of a peripheral entrapment, where that nerve is just simply unable to get through that particular spot. So most often, like I said, people are coming in kind of panicked, thinking they've got this horrible diagnosis like sciatica that nothing can help. They think they'll need surgery. And the reality is, it doesn't even have to take that long, maybe a month or two, really getting our hands into the tissue. As you know me probably by now, I'll do some forms of deep tissue release. Actually, forms of dynamic cupping can really be helpful. And right off the bat, I would probably hold off on dry needling just because it's sensitive. But I might work actually above or below the area where I feel like that nerve's kind of entrapped. And that actually is a really good way of just desensitizing the entire area. And that's where we'll usually start by opening up the hamstrings and doing some stretching. For some of those, you might call it flossing even to some extent, where you're just kind of moving the nerve in and out via a hamstring stretch. And actually what we're finding too is that people are having just poor posture in general. So we'll actually want to go in and start the process of loosening up even the low back in addition to that. But yeah, the one secret I just wanted to share with you guys today is that a lot of people are coming in with what they feel like is sciatica, and actually what it turns out is to be something much less severe or significant. It's usually kind of borderline either a hamstring myofascial pain, which can become so tender it feels like there's really something wrong, but in reality it's just a really balled up, cranky muscle, maybe not getting the oxygen it needs or the blood flow it needs. Or you could kind of look at it as maybe the nerve's getting stuck, and it probably is a little bit of a combination of both. And actually by loosening that up and understanding the relationship to that hamstring and that nerve, and maybe even the above and below joints, what those are doing, it's only taken people usually on average around here between 6 or 8 visits, maybe 9 over the course of a couple months, and they're totally back. So if you're currently suffering with sciatica, or maybe you know someone that's really been bothered by this, and it can be pretty hampering and really hold people back, feel free to share this video with them, and just maybe they too, or maybe they're working with someone, just start to investigate the hamstring a little bit more and see if they can find that spot that I'm kind of referring to, that I often see being the spot that needs to loosen up to help wick away their sciatica-like symptoms. Alright guys, thank you guys so much.